if you've had coronavirus and you've been asymptomatic or you recover from it, what is the risk to you down the road? Do we know that information?
Yeah, it's a really insightful question and a key one because of course we'd like to know that somebody's no longer at risk, and on the healthcare side we'd like to know that that person could be deployed and be used on the front line, so to speak, without risk. The problem is we don't know that.
Hmm.
We will soon know and be able to do serology where we can test for that antibody. Granted, we don't know the correlative protection, so what level of antibody. There are also differences in inoculum size. So, for example, a layperson walking in the grocery store next to somebody that might be infected has a lower inhaled inoculum size than, say, an anesthesiologist who's trying to intubate, or a pulmonologist who's doing a bronchoscopy, where that load, were they not taking precautions, would be quite high. The other thing that we do have some data, this is fairly new data, if you look as long as 6 years out in patients who had SARS in 2003, they appeared to maintain high enough antibody levels.
Okay.
By 6 years, that dropped off. So that's one point of data. The other point of data is in the seasonal coronaviruses, that immunity appears to only last a few months to a year. So, here they are. They're all coronaviruses.
Yes.
They're all beta coronaviruses acting differently in the immune system. So as I try to point out to people, one has to realize that with this particular strain, our expertise only extends 12 weeks.